This has been an effort that has really crystallized into a clinic, but it will go more beyond that, and over the years will blossom into a 4-year comprehensive dental program, bringing all the great assets of this community, both in terms of the organizations in the community and the spirit of this community. So we feel very privileged to be part of that, and very privileged to be able to partner with such outstanding groups. And I'm now going to ask, because on your behalf, you've already asked him, I'm now going to ask Dean Reagan to come up and help walk us through some of the specifics. But thank you for the opportunity. Mayor?
Did you bring this part of the goalpost? I had to ask. Go Bulls.
I should be smoking a cigar, I believe, as you asked that question. Dean.
Well, good evening. How about those vaults, huh? You know, my feet just hit the ground about an hour ago. I think I was at the game. It was a great experience. But thank you all so much for having us here. I'm a native East Tennessean, born in Knoxville, raised in O'Fallon. If you don't know where that's at, just west of here. And so, you know, my heart is back here, you know, and I grew up with folks that had a need, you know, for dentistry and healthcare. And so if there's anything that we can do to come together, I think that's what we need to do. And I think this is historic. It has to be. I don't think we've ever seen anything like this, with all the good people that have come, with all the power that they wield, to come together and unselfishly to help the citizens of the Highlands. So thank you all very much for having us. Mr. Mayor, Alderman, thank you so much. We'll go through this. I'm sure you've heard about the situations that we have. Tennessee is ranked, this was in a report that came out from the U.S. News and World Report back right before the pandemic hit. Tennessee was ranked number 43 when it comes to access to care of its citizens when it comes to dental care. And that breaks my heart as a Tennessean. We should not be in that position. Because, you know, when you think of dental care, it's not just pretty smiles and braces and all that, but it's health care. There's such a close tie between the oral health care and the systemic health care that we just can't let it go unnoticed. And it improves family, social life, it economically, all these things enter in. So we need to be better than 43. There's just no excuse for that. 90% of our counties are below what the American Dental Association health policy statement of 61 dentists per 100,000 folks. That would be about 1 dentist per about 1,600. So 90% are below that. We have another 27% that are below 20. And unfortunately, those counties are where some of our lowest income earners are. And so it just exacerbates the situation. We began looking at what can we do as far as the University of Tennessee Health Science Center back pre-COVID, because we knew that there was a dental shortage. Just this past week, I was at the Tennessee Board of Dentistry meeting, and they announced that they have less than 4,000 licensed dentists in the state right now. Now, if you look, that's a drop from 4,211, which I reported last year. And out of those less than 4,000, they're not all practicing dentists. I'm a fully licensed dentist, and I practice very little dentistry. Some of those licensed practitioners have limited license or educational license. They're teachers. Or they practice at VA centers or exclusive places. So they're not out doing the basic ambulatory dental care that folks need. Also included in that would be all the dental specialists. So the folks that do the root canals, the braces, oral surgeons, they all have to have a license, right, before they can get their specialty training. So we are in a critical need of dentists in the state, and it's getting worse. We have, you know, I think fortunately for our state, we have folks moving in like gangbusters, right? And we're like one of the top 3 states that folks are moving into from New York, from California, from all across the country. Most are moving into the Nashville area, and they're actually doing not as bad as other parts of the state when it comes to access to care. But you look at the fringe, you look at East Tennessee and West Tennessee, and we describe it as a dental desert. There are counties that have no dentists. There are counties that have 2, 4, 5 dentists. And those dentists graduated in my year group, 1984 or earlier. And they're all starting to retire, and I think that's what we see when we had a drop of 200 dentists last year. So there is a critical need for dentists. We would estimate somewhere around 800 or more just to get to that 61 per 100,000. Most critical in the rural areas. So what's our plan? What can we do to alleviate this? Well, first of all, we need to provide a facility and providers to treat these folks, right? And so as an educational institution, we can come together with the good folks at ETSU, lock arms together and put a clinic in place. And we want to do this in a measured, phased way because we want to make sure that we're moving towards success. If we start off with opening a dental school, you don't have the patient volume, you don't have the faculty that you need, because you need faculty in all the specialties, then you're doomed to failure from the beginning. But we felt if we start somewhat small, we get practice people that can get out and immediately start treating patients, and then we can bring patients in, we can grow it, and then in measured steps, we move forward all the way from a small clinic up to a 4-year program. So first step would be what we call an advanced education in general dentistry residency. These are actually dentists that have graduated from dental school. They've gone through a 4-year program. The beauty of it, they can go out and work independently. So they may work at our clinic here in Kingsport, but then they can go to other clinics in the region and work as well without direct supervision from a director. We can also place, it says D4 and DH2, those are 4th-year dental students and 2nd-year dental hygiene students from ETSU. We can put them in there for training opportunities. Now these are great training grounds for these students. The unfortunate part, they're only there for a couple of weeks, so they can't do the crowns, the bridges, the implants, that sort of thing. But they can do extractions, cleanings, take care of emergencies, do dental fillings, and really make an impact on the community. Are there any questions to that?
Board, we're good so far.
Excellent. What is the investment for that first part? It would be a $1 to $1.3 million startup with about a $1 to $3 million build out. Recurring fees, which would include rental, faculty salaries, overhead costs, lab expenses, would estimate around $800K. And we need a clinic size of about 7,000 square feet. And this will provide an adequate training facility for 4 to 6 dental and dental hygiene students and 4 residents. Now let's assume that things go well and we get out in the community, we increase the patient volume, we get all the specialty needs covered. It's a wonderful training opportunity. Back in Memphis with the Healthy Smiles Initiative, we're increasing our class size from 100 incrementally up to 130 students in a class. Well, we don't have the training facility in Memphis to accommodate that increase of 130. So we need to send them somewhere to finish their dental training. So what our plan would be all dental students would come to Memphis for the first 2 years to get their pre-doctoral training, to get their basic science, to get their technique courses out of the way so that we're comfortable that they will be a good clinician. And then we send them out. Now right now we have these 2-week rotation clinics. We've got them in Bristol, we've got them in Oak Ridge, or in Chattanooga, and in Union City, and we just began a 4th one in Crossville. So, we would have one here, we hope, in Kingsport with the AGD. But once we get to a 3rd and 4th year training facility, then we could actually send 12 to 14 3rd-year students here to Kingsport to finish dental school. So they would spend the last 2 years here. It would be phenomenal for students in the region. They want to go to dental school, they do the pre-dent, they come back here and do the last 2 years of training, and hopefully they'll stay in the community and continue to service the patients there. Going hand in hand with that would be ETSU with the dental hygiene students working with us. And we would hope to get support from the faculty as well, because we have teaching in pathology and anatomy and things that have a strong tie-in with the College of Medicine, College of Nursing, as well as the College of Dental Hygiene, or School of Dental Hygiene as well. AGD residents would still be here, and it would also serve, again, as a hub. They can still go out to other clinics and service the needs in those communities. Are there any questions on phase 2? Okay. Phase 3 would be the 4-year comprehensive dental program, and this is the full enchilada, if you would. This would be the whole 4-year program, and we will have to have a strong partnership with ETSU at that point. Now we've created, we hope at this stage, a strong partnership with Ballot Health, because we will need them for our AGD residency to support us with GME funding and training at the hospital. And then we can also help Ballot by seeing the emergency patients that might come into the emergency room as well. So with the 4-year training program, it would be the entire 4 years of school. We've talked with our accrediting body, which is the Commission on Dental Accreditation, called CODA, and we asked, is this something that could be done? You know, can we work with a major institution and put together a dental school? And they said, well, they don't know why we couldn't do that. In fact, they thought it was a pretty good idea that we could have a co-sponsorship. And that would be the only model in the country. And they said other states might want to copy that, because many states have the same problems that we have in Tennessee as well. So we're very excited about that. And again, that's an aspiration. And again, we think we should start slowly, build up toward that, make sure that each step is measured and that we have success along the way before we proceed to the next phase. Any questions on that?
Thank you for following me.
Okay. I had the privilege of coming. We've had meetings throughout the past year and half almost, and I had the privilege of coming last spring and looking at some sites locally. And this one was one of the last buildings that we looked at, and it really struck us as an absolutely perfect place to have our clinic. It's at 111 West Sevier Avenue, second floor of the building. It was a former oral surgery clinic. It's already set and plumbed to be a dental clinic, so I think the cost of setup and beginning the operation would be less with that, and it's in an ideal location because it's right across the street from the hospital. So we really like that. I don't know if anyone in the audience that had anything to do with the building has any comment to make about it, but now would be a good time. This is a funding letter. We talked about the cost of the initial investment to start up, and we can't do that alone. We do have some wonderful sources, the Healthy Smiles Initiative. We do have some funding that will cover some of the expenses. The GME funding from the government that we work with Ballot on that through the residency program. And then I understand that the Appalachian Regional Commission is working toward a grant. Certainly the city of Kingsport, we appreciate that so much. It can't happen without your all support. ETSU, I think this is a wonderful partnership. I think this is like none that I've ever heard, you know, in the world of dental education. And so I'm very, very excited about that. And then the private funding that was mentioned, you know, with the insurance companies, all of that will be key as we move forward. There are challenges. Again, we talked about the building, we talked about the initial investment. We have recurring expenses. I can tell you, being dean of a major dental school, we are not a for-profit business, okay? We are a losing business because the folks there are training. So it takes them all afternoon to do one filling. But we want to make sure that they do it, and they do it right, and that they're going to be a quality dentist. So we don't cut corners on that, and we certainly wouldn't cut any corners of any training that we would do here in Kingsport as well. We have all the costs that are associated with that, administrative costs, the AGD, we have to have GME funding to make that work, but we feel pretty certain that would work out for us. And then the two concerns that I do have, one would be the patient volume. We have to have enough patients with all the different dental specialty issues that would train dental students and residents. We have to have the qualified faculty to make this work. But I can tell you that I've had wonderful support. I've met with the first district, Tennessee Dental Association here. I've met with them twice, and I've gotten their full support. I've gotten a letter of support from the president saying that they support this initiative and they will help as much as they can with faculty and helping us to recruit people. So I really feel comfortable that we will be able to get the faculty we need. get the specialty support we need, and with the tie-in with UT Medical Center in Knoxville, as well with our campus in Memphis, if we need any specialty care that has to come into play, we can do that. And then in this day of age, with Zoom and teledentistry, we can certainly make up any shortcomings with that without any problem whatsoever. So I don't really personally see anything that we can't overcome as a team. I can't do it alone. I won't attempt to do it alone. But I think as a team, we can make this work. I really do. And I think as a Tennessean, it will make more my heart if we can get there and help our citizens. Are there any questions of me? Paul, I've got a little hay fever, so I'm
What kind of
choking.
staff are you talking about in, like a startup?
Startup, we would need at least one director for 4 residents, and then probably several part-time faculty to help. And then we need specialists to come in to oral surgeons, endodontists, periodontists, on not a full-time basis at all. With our 4th-year dental students and dental hygiene students, again, it's more in the realm of general dentistry. So then we would probably have a full-time director, maybe an assistant director, and then again some part-time faculty. And my last visit here, when I met with the 1st District, I had a number of dentists come up and say, "Look, I'll come and work for a day, half day, or I'm ready to retire and come and work." So, I think we'll be fine with that. As you move into a 3rd, 4th year, now you're going to need more specialty. You're going to need, particularly with ETSU helping us with pathology and some of those courses, pharmacology. And you go to a 4-year program, then we're going to need basic science training and anatomy training and that. And so that would be definitely a cooperation between the 2 universities.
I would think that some of your patients would be charitable type cases and others would be paid.
Yes.
Do you have kind of feel what that would?
I don't know what the percentages would be of that until we actually get out in the community. But the clinics that we work at now in the rural areas, most of them work on a sliding scale. Our clinic at Union City, which is our clinic, we have our director and our staff there. And every patient that comes in the door, I wouldn't say ever, but almost all of them pay $10. And for that $10, they get whatever work they need. If they need 3 teeth extracted, they do. If they get 2 teeth extracted and 4 fillings or partial, they get it for $10. And then, certainly we have insurance and that sort of thing as well. And they have patients that go to that clinic that are not low income, but they just like going because they like to get back to the community and they like working with the students there as well. And our students get so much out of it. I mean, to be able to get back to the community and to work, on folks that have the needs. And it's just, it's hard to describe the feeling of warmth that you get when you do good like that.
Any more questions?
Very good. Well, at this time,
Thank you all so much for the
Thank you.
opportunity, and we'll be around to answer any questions. Thank you.
very good. Thank you, Dr. Reagan. At this point, I'd like to ask Dr. Nolan to make a few comments regarding ETSU's involvement.
Well, Mayor, members of the board, good evening. On behalf of our board of trustees, it's my pleasure to be with you tonight. And I want to set my comments within the context of the history of this institution. More than 110 years ago, the people of this region came together to bring an institution to Northeast Tennessee to help train teachers to ultimately go into the rural regions of the state and raise the quality of life of the people of our region. 60 years ago, the people of this region came together to create a College of Nursing, which is now the largest college of nursing in the state of Tennessee. And we have a significant presence here in Kingsport, training nurses to move into the Allied system. More than 40 years ago, this region came together to create a College of Medicine, which is the driving force for change from a healthcare perspective in our region as a whole. A College of Medicine that is now ranked in the top 25 nationally for its ability to place physicians in rural areas. And as you look across the impact of this institution on our region, I know we are East Tennessee State University, but in many respects, we are the University of East Tennessee, the university that serves this region. We educate your doctors, your nurses, your teachers, your business leaders, but there's a gap, and that gap is in dental education. More than a decade ago, I had the honor to go with a number of members of Kingsport over to Memphis to meet with leadership from the University of Tennessee Health Sciences Center to look at the opportunity for a partnership. Conversation moved a little bit, but it didn't move far. And I want to point to a little bit of a frame of why we are present with you this evening, and that's because of the leadership of Chancellor Buckley. I've had the honor to serve as president of the university for 11 years. He has been here more in the past 6 months than any other chancellor of that institution in the past decade. And I cannot thank him enough for the spirit of partnership and the way in which he examines the healthcare needs of the state as a whole and the opportunity for two institutions to partner to get farther faster. To Dr. Reagan, I want to thank him for his leadership as well, and he used a critical phrase, slow and steady. I think as we approach this and we move through the phase of clinic development, clinic operation, and clinic growth, that slow and steady approach of moving at this methodically, focusing on the needs of the region, and allowing those needs to grow is something that ultimately will serve us well, just as the examples that I gave of the history of the institution have served the region well. We are honored by the opportunity to partner. I can say in the 11 years that I've been president, I've never seen slides with UT's logo and our logo on it concurrently. It is wonderful to see two institutions working together in the way that I think you'll see these two institutions work together. I'm not in a position to talk about football victories, even though we are the reigning Southern Conference champs. But we do commend UT for their accomplishments on and off the playing field. But most importantly, we look forward to the partnership in the clinic that we hope will open here soon. Thank you for the opportunity to appear before you this evening and be happy to address any questions.
First, Dr. Nolan, we appreciate you coming tonight. And, this board received a couple of weeks ago an excellent presentation from your nursing school, and we were very interested in that project.
Thank you, Mr. Mayor.
But board, any questions for Dr. Nolan? Okay, thank you.
Thank you.
All right, at this time, I'd like to recognize Clay Reynolds. Clay is representing Ballot Health tonight. Ballot makes up the fourth partner in this with UT, ETSU, City of Kingsport, and Ballot. Clay?
Good evening. Thank you for the opportunity to be here. We're really excited about this as well. I'm Clay Reynolds. I'm the Chief Physician Executive for Ballot Health, and I have some brief prepared comments. As I said, we're very excited to be part of this partnership that will change so many lives in the Appalachian Highlands. The primary objective of Ballot Health is to improve the health of all the patients that live in the Appalachian Highlands region. And this investment in Kingsport, we believe, will do just that. Dental health is an important part of overall health for people and for patients. There are a number of more serious conditions that are tied to dental health that people don't always think about, such as heart health and complications with pregnancies that can be tied to poor oral hygiene and dental health. So it's something that is right in our area of interest as we aim to improve health in the region. Dental health is one of the biggest factors that we need to consider. The problem in our region, as many of you know, is the very poor access that we have to dental care, especially in our more rural areas. And half the battle is simply having enough providers to meet the need. Over the years, Ballot Health has invested in several programs to mitigate this challenge, including opening the Appalachian Highlands Community Dental Center in Abingdon, Virginia in 2020. Investing in dental care has the potential to improve hundreds of thousands of lives across the region, and we are thrilled to be a part of this new venture. The clinic will go a long way toward ensuring that we're providing the best possible care for every patient, and this is a substantial solution to a long-standing problem in our communities. Programs like these are essential to ensure that people in this region have regular access to dental providers, and people who have regular checkups at the dentist will be more likely to resolve dental issues before they lead to a more serious condition. We're looking forward to joining the City of Kingsport, ETSU, and the UT Health Sciences Center in this endeavor. And I want to personally say that in working with this group, that I've never worked with a group that was more aligned with regard to community service. There was no, hey, what do we get out of this? What do you get out of this? It was really just single-minded toward what we can do to serve the community here in an area that's really important. And I've appreciated that. I've actually enjoyed working with this group, and I'd like to thank the groups from UT, from ETSU, and Kingsport personally for the opportunity to work with them. So thank you again for allowing me the opportunity to speak tonight.
Thank you. You really impressed me with that description of the alignment. It's quite a partnership, and we're excited that Ballard is part of it.
Mayor, at this time, I'd like to ask the board to consider pulling from the agenda 6D9. This is an action form and a resolution, and I'll walk through this with you. This is the consideration of a resolution authorizing the mayor to sign a memorandum of understanding with the University of Tennessee College of Health Sciences, East Tennessee State University, and Ballard Health to establish a dental clinic in the city of Kingsport. As Dr. Reagan identified in his presentation, our role as the city of Kingsport in this is very similar to the role that we've had with the academic village. We provide the space, then we leave it up to the higher ed institutions to come in and provide the programming. That's what we will be doing in this step, moving forward with our partner, the Economic Development Board, to move forward with establishing. We already have an LOI on the space that Dr. Reagan presented later this month. We move forward in executing that lease, and then we'll be working with a variety of folks to build out of that space. So we're very pleased to be able to bring it to this point. I probably could spend the remainder of the night thanking a lot of people, and I'm sure I have missed some folks, but there are a few in the room that really need to be recognized. And I would, after the vote, also like to recognize one special individual as well. Obviously, our state representatives are here. I mentioned Senator Lundberg and Representative Hicks, but Representative Fox is here. Representative Campbell is also here with us. Thank you all for being here. And I know you guys are going to be a major player in this project as we move forward, and we thank you tremendously. Eastman, CG McCord's back there. She told me, I think the first day I met her, that Kingsport equals partnerships. You hear me say that a lot. I stole that line from CG. But also representing Eastman is Paula Rucao. These folks have been extremely instrumental in facilitating, making things happen. Of course, I talked about Mark Cox earlier. But then in addition to that, I can't help but look in the room and see Mayor Dennis Phillips, our former city manager, Jeff Fleming. They opened some doors a long time ago and got us started thinking about this. And I know both of them were pleased to see where we are at today. And I thank both of y'all for really it's everything you do every single day for the city of Kingsport. In addition to that, we have many local dentists that are here that play huge roles in this. They continue to play a huge role in what we're doing here, and that will only continue as we move forward. So really, as you heard the speaker say, this is a result of partnerships. And I'm glad that the city of Kingsport is right here in the center of this partnership. And I think together we'll be able to work towards the vision that's been laid out here and be something that not only this city, but this entire region will be extremely proud of. So Mayor, I present this resolution to you. I ask that the board approve this, allowing us to move forward with not only signing this MOU, but also moving forward in establishing our position within this partnership.
Well, thank you, and you've appropriately recognized and thanked many folks who were involved out here in the audience. You did a lot of work on this too. The board appreciates your work. I guess I got to be nice to you. But thank you very much, Chris. You have done a lot of work on this. Mr. Attorney, please publish.
A resolution approving a memorandum of understanding with the University of Tennessee Health Science Center, East Tennessee State University, and Ballard Health to establish a dental clinic, authorizing the mayor to execute the memorandum and all of the documents necessary and proper to effectuate the purpose of the memorandum of understanding.
Thank you. I'm going to deviate from our normal procedure, and because this is a momentous occasion, and I'm going to ask my colleagues on my right, led by Vice Mayor George and then Alderman Cooper and Duncan, if they would like to put the motion forward for approval. Okay? Thank you. It's on the floor. Do I hear a second from my colleagues on the right, Alderman Overman, Phillips, and Montgomery? Thank you. Is there any discussion? Okay.
We could have a lot of discussion.
We could have a lot of discussion. We appreciate
collaboration between us groups, and look forward to
Thank you. We do thank you. If there's no further discussion, all those in favor, please indicate by saying aye. Aye. Any opposed? The item passes 7-0. Mr. City Manager.
Mayor, this time I would like to ask Mark Cox to come up to the podium and just make some final remarks. Mark has been the leader behind this. You heard that in my opening remarks. Mark has been very instrumental in getting a lot of doors open, having a lot of conversations with folks, and really helping to lead the effort for this on behalf of Kingsport. So Mark.
Well, Mr. City Manager, thank you for the opportunity, and I echo the mayor's comments regarding your effort and involvement. I would say, Mr. Mayor, Ms. Vice Mayor, Alderman, Mr. City Manager, thank you for taking this historic action, strong action tonight regarding the Appalachian Highlands Dental Project. I would say the chief executives of 3 of the 4 entities are with us tonight. Chancellor Buckley and Dean Reagan, President Nolan, City Manager McCart, Mr. Levine had a prior engagement out of town, but he was very involved. And Dr. Reynolds, thank you for your involvement. I hesitate to mention names because the list is extraordinarily long of people who have come along and put a hand under this to help support this action across this state, across this region. And many of them have not even been publicly named. And some of them are in this room and haven't been publicly named. But I think when you talk about helping your neighbor, and speaking of helping your neighbor, someone pretty important once called us out to do that. And what I think this represents is the best of UT Health Sciences, ETSU, Ballard, and the City of Kingsport coming together, showing love to our neighbors in need, in the now, through the clinic, but also taking a first step toward an unbounded future for this project. The vision of making the Appalachian Highlands a center, a regional center for dental care. And there's no reason that can't happen. Why is affordable quality care so important, we would ask? It has much to do with the physical health and the mental health. We know that's true with dental care. From pronouncing words properly, to chewing protein-laden foods, and all the self-esteem elements that come with that. It's a critical part of giving folks a hand up, and there's only upside here. I would venture that most of us in this room have benefited, if not all, from someone's selfless act in a prior generation. I hate to call one person out, I know Randy Montgomery's here, but his father was a dentist here, and my grandmother, who raised kids in Southwest Virginia in the middle of the Great Depression, took her kids to him. He championed fluoridated water in this area, and his wife and Randy's mother was once mayor of this great city. So we have a legacy of giving to our neighbors. Sometimes, it's difficult to get 4 people to agree upon where to go to breakfast. Think about this: 4 boards of major organizations came together to support this, to selflessly pursue this vision, inclusive of our neighbors in Memphis. Isn't it a fabulous thing? So I'll close by saying, is this agreement unprecedented? I don't know. I think it likely is. Is it the beginning of something extraordinary for our region? The answer to that question, I guess, lies with us. But based upon the past 14 months, I believe it is. Thank you again for your actions tonight.
Thank you, Mark. And I know you were involved, but your heart was in this, being a native of this area and a UT grad. So thank you very much.
Mr. City Manager, you suggesting we recess now?
I suggest 2 things. One, I'd suggest a round of applause for everybody involved, and then about a 5-minute recess.
That's 5-minute recess. Thank you.
I think so.